New information, we are a little more than a week away from the projected coronavirus surge in Alabama. You're taking a look now at projection models from the University of Washington. This model is updated constantly. It predicted at least 93 deaths in Alabama by today. Right now, we are exactly at 93 reported deaths. The model predicts that the number will double by next week. And by the end of May, Alabama could see more than 400 deaths if this model holds true. Wait 31's Alex Torres-Perez joins us live from outside Huntsville Hospital. She learned how researchers hope this data could help save some of those lives and what the hospital is saying about the projections.
Now, you may be wondering how hospitals across Alabama are expected to use projections to prepare. Well, it's all about the peak day. That's the day that hospitals will need the most amount of resources like ventilators and beds for coronavirus patients. That day here in Alabama is April 19th. And if that's accurate, that means Huntsville Hospital and hospitals across the state have about a week to gather all the supplies they need.
I think they're all wrong.
Huntsville Hospital CEO David Spiller says he's looked at several projection models for Alabama. The hospital even made its own projection model. Still, he doesn't believe the information on it is accurate.
If we keep trending like we are today, though, we're not going to peak at the end of April.
Dr. Ali Mohtad is the Chief Strategy Officer for Population Health at the University of Washington. He was part of the team that created this projection model that is now used by the Centers for Disease Control and the White House.
Very confident about this average here.
He says he's already seen how these projections can help save lives. After the first coronavirus case and death in the country was confirmed in Washington state, the University of Washington took this information and made changes. It moved its classes online, canceled elective surgeries, and started gathering supplies and beds for its hospitals.
We are now seeing in our hospitals that what we have done based on this information has helped us a lot to be prepared. I mean, we see it, it's working. What we want from these models is for all the country and every state to do exactly this.
Spiller says they're still preparing for the worst case scenario.
We're prepared for a massive number of patients. I don't think we're going to get them.
Despite their disagreement on whether the projection model works or not, both Spillers and Mohtad can agree that at the end of the day, it's up to you to stay at home in order to end this pandemic sooner.
If people will keep doing what they're doing, the numbers are not going up.
We all want to go back to our normal lives. We're all tired of being at home, but we have to hang in there and we have to be serious about it, and we have to take care of ourselves and our loved ones.
Now, projections can change depending on certain circumstances and practices in a state. For example, before Governor Kay Ivey issued a stay-at-home order, the model projected thousands of deaths and shortages of beds here in Alabama. But now that that stay-at-home order is in effect, the number of projected deaths, has dropped significantly, and hospitals in Alabama are no longer expected to see a shortage in beds. Reporting live in Huntsville, Alex Torres-Perez, Wait 31 News.